All right. Hi, everyone. We're super excited about this morning's meeting. We're going to have a nice little celebration of the work happening in Southeast Ohio with some of our friends down there. So I will introduce Michelle and Paul here in a moment. But before we kick off, I did want to do the weekly budget update from what's happening at the State House. Um, Groundwork testified 2 more times this week. So we were in the Ohio House Health Committee as well as the House Medicaid Committee. There's been a ton of public testimony this week. Committee meetings have been running very long, but the House Finance Committee did not meet this week. They are meeting next week, and there will be more opportunities for public testimony. So we'll send out an alert and we'll link our testimony toolkit in the chat again this morning here. But if you would like to testify and you missed the opportunity in Medicaid, Health, or Children and Human Services standing committees, you can 100% testify next week to full finance committee, and you can submit that written if you're not able to make it in person. If you do come in person, I would just warn you that they're probably going to have such a long list of folks that they will be pretty strict with the time limits. I've seen them in the past do 2 or 3 minute limits, and it can be a bit of a fatiguing day. And I'm not saying that to discourage anyone from coming. I think it's really powerful to be here in person if you're able. And perhaps that will time out that you'll be here for our Advocacy Day on March 12th and you pop over to committee afterwards. So please do, if you haven't yet, check out our testimony toolkit and consider submitting some testimony next week. We are hearing that amendments are going to be due halfway through the month, and I'm going to double check my calendar really quick. March 14th, Friday, March 14th, amendments will be due to the House, to the governor's version of the budget. And then the House will turn around and release their version on April 1st. There's one more shot for amendments that will be due April 3rd to the House version. So that's a really quick 2-day turnaround. We expect the House to vote the budget out of committee on April 8th and off the floor April 9th. So I'll go ahead and put those dates in the chat, but I don't want to spend too much more time. If folks have questions, feel free to chat in the chat function, but I really want to get to the content of our morning. I think Michelle and Paul are going to sort of present together, which I think will be a really fun, engaging format, and appreciate you both. Paul, I heard you're traveling today, so thank you for making this work on top of all of the logistics. I'll just read their bios briefly. I've had the pleasure of meeting Michelle and Paul both early in my tenure at Groundwork and getting to come visit them in person in Athens and Portsmouth as well. We've had Paul out to, and we had them both out to a few road shows. So it's great to see you both again on Zoom. Michelle is with COAD, which is also known as the Corporation for Appalachian Development, and she's the COAD4kids Division Director. So Michelle is headquartered in Athens, and she's originally from Northeast Ohio. She has her bachelor's in geography from Miami and has traveled the U.S. as a GeoImmersive Data Producer. So she's got a very diverse background that she's bringing to this space. And she also has her Master's of Arts in Geography from Ohio University. Michelle also served for 2 years as AmericCorps Vista with Athens County Children's Services and Live Healthy Appalachia, where she developed the Live Healthy Kids cooking curriculum for elementary school students. She also served as the president of Athens Area Chamber of Commerce before she joined COAD in January of 2023. And she oversees COAD4kids Division efforts in recruitment and supporting foster and kinship care placement, establishing new child care centers and family child care businesses, and of course, the delivery of the CCR&R services in Appalachia. So really excited to hear from Michelle about that early learning space. And Paul Isherwood comes to us from Ireland, where he came from to study at OSU. And he is now living in Athens and has had a career in education, but has been working for Hocking Athens Peary Community Action as the first Athens County broadband coordinator before his current role. He developed a network of local stakeholders to develop a community-led solution to the county's broadband deficits, focusing on attainable strategies rooted in the best interests of the region. And 2 years ago, he moved over to COAD, where he has since been the director of a new initiative called the Pathways Hub. Pathways offers community health worker services to some of the most vulnerable members of communities across 15 counties in Southeast Ohio, utilizing the nationally recognized Pathways model. And through this work, Paul has become very involved with both healthcare and social service sectors in the region, and he can give you great insights to social drivers of health in Southeast Ohio. So thank you both so much for being here. I invite you to come off mute and just dive in whenever you're ready.
Just one correction. I'm a Pride Bobcat, not Ohio State. That
Oh, I
Yeah.
am so sorry.
Yeah,
That
it's
is a
okay.
huge error.
I'd be in big trouble down here in Southeast Ohio if people thought I was bragging from being OSU and not a
My brother's a
Bobcat. So
Bobcat. My
I
brother would be
wouldn't, I'd come
mortified.
back from my trip and I wouldn't, my office would be barricaded. I wouldn't be able to get in. So
Paul is squarely OUO, yes.
yeah.
Thanks.
So I guess Michelle, I'll start off. Yeah. So, because it's the order we had it created in. I'm not trying to be talk over Michelle at all, but yeah. So in the role that I'm currently in, we set up the region's Pathways Hub. I don't know how familiar you are with the Pathways Hubs. There are now 12 Pathways Hubs in the state, and we will work very, very closely together. In fact, we have a 501(c)(3) that we have together called Partnership for Advancing Community Health, and I'm actually going to be missing the board meeting of that. But we work very well together. We've been assigned 15 counties in Southeast Ohio. It's a very challenging area to do so. A lot of the hubs only serve one or two counties. And so we have this very, very large rural expanse. Since we launched in 2022, we now have 6 agencies. We're working primarily with our community action partners. COAD is a coalition of community action agencies in Appalachian, Ohio. So right now, the agencies we're working with are community action, but we hope to expand that. We're currently talking with some public health departments as well as about coming on board within the hub. We have 28 community health workers operating throughout those counties now. We'd like it to be more. We're funded primarily by an Appalachian Regional Commission Power Grant, and we also have funding from the Ohio Commission for Minority Health. We are one of the things about the Pathways Hubs is that we have the ability to bill Medicaid managed care for our outcomes. So we're contracted with 2 managed care organizations at the moment in doing that. So we're an outcome-based program. And what a big issue of what we're trying to do is try to bring care coordination into the community and do it more effectively. And this is really critical in an area of the state where we have a significant lack of services and resources and providers. So where we can reach people in the community through our community health workers, and our primary target audience, in part because of our funding, not necessarily because it's the need, is pregnant women. But we hope to expand that. We know there's a huge need beyond that population. And one of the great things to remember, and if anyone wants this information, I can send it on to Brittany. There's a lot of research to show the return on investment of investing in community health workers. It is a method that works. It's a method that is something we should do more of.
Thanks, Paul. And we're happy to send that out in our follow-up with the recording to everybody.
Sure.
Yeah, thanks, Paul. And so I did go to Miami for undergrad, but made up for it by coming to OU for my grad school career and then stayed here. So yeah, thanks for having us, Brittany and Groundwork. I represent the COAD4kids Division, which is Child Care Resource and Referral agency that serves 31 counties in Appalachian, Ohio. So I see some other R&R folks on the call. So thanks for your work as well. So as many of you know, we provide the training and technical assistance for our child care educators in this region. Like Paul was mentioning, our population is small, but our geography is vast. It takes about 3 hours to travel from one office to the other. So we have offices in New Philadelphia, Marietta, and Piketon. That represents 3 of the service delivery areas identified by the state. So we support, I just pulled these numbers yesterday for my boss who presented to the Appalachian Children's Coalition Legislative Breakfast. But we support 484 licensed centers, Head Starts, and family child care providers. So a lot smaller than some of our urban areas, but again, lots of traveling to do to support those centers. Just like everyone else in the state, we are unfortunately seeing basically for every family child care provider or center that opens, 1 or 2 closes. And so the trend is downward, unfortunately. But we have a FCC shout out. Thanks, Stephanie Denisio, in our region. And We have funding, additional funding through the Department of Labor, which is really great that 3 years ago, the Department of Labor saw childcare as an issue. Obviously, it's becoming more and more known through workforce development as a barrier to entering the workforce. So, you know, I know we see in the governor's budget a lot of investment in childcare and a lot of folks from workforce who are supporting that. So, you know, that is great. We appreciate it. But, you know, we need more investment in that space from a variety of players. So, but through our Department of Labor grant, we have funding to help specifically family child care businesses in opening. So we're able to provide funding in a variety of ways for that. And then we also help employer and now more so community supported childcare, we're calling it, because you know, a lot of economic development agencies are realizing the need for investment in childcare. So we have 4 counties we're working with now specifically that kind of started as a grassroots effort to open childcare businesses just to increase access. So we're partnering with those agencies and organizations and businesses to do that. There's a new public-private partnership funding opportunity through the Department of Children and Youth. And so we're really just trying to assist different organizations and businesses in finding creative ways to make those public-private partnerships work. So that funding just opened up and we look forward to, you know, finding ways to apply for that funding and make it work for those folks. That's what I have for background on the Child Care Resource and Referral Services. Of course, in addition to supporting child care providers, we also have the Foster Care Hub. And so we have folks who work through with potential foster care providers to walk them through the licensing process and make that easier for them. And then new this year for the Child Care Resource and Referral agencies, we have parent and youth ambassadors. So they are like a resource center for families to call to get assistance with whatever they might need. So we like to refer to them as a way to connect families with existing local and state resources. But also when we identify gaps in services, we have a direct line of communication with the Department of Children and Youth to let them know what those gaps in services are. So right now, housing and utilities is coming up as the main kind of barrier that folks are needing assistance with, but are lacking the ability to get that assistance due to a variety of factors. So we're able to report those barriers back to the state. All right, Paul, I'll turn it back over to you.
So I guess things that in the budget, in the state budget, we're really pleased that in the governor's version that there's continued funding for the hubs. The baseline funding for all of the hubs, which grew out of a Senate bill in 2017 or 2018, I can never remember, was funding for the Ohio Commission for Minority Health. And it's an initiative to target the discrepancies in African American and minority infant mortality rates. Us being a rural hub and with a very small minority population, we are able to access that funding, but we are able to, while we make a significant effort to reach our minority populations, we're sort of exempt from some of those targets. And part of that is the Commission's recognition that there was a significant need for a hub in Southeast Ohio, and that a lot of the challenges that are faced by our minority populations in the state of Ohio are also faced by our Appalachian population too. And so the leadership of the commission were really, really supportive of getting a hub in Southeast Ohio. So we're pleased that the governor recognized the impact that the hubs are having and wanted to continue the funding of that program as it existed. We also, he's the Center for Community Health Worker Excellence that the governor has established. He also wants to continue funding operation of that. That body is really critical to helping bring the work of the various organizations and entities that are doing community health work with certified community health workers are bringing it together and coordinating it. And so we're really pleased to see that, and we would urge any chance you get to engage with that body if you're interested in the work of community health workers, but also to encourage people to continue to support it. It really is critical. Ohio is at the forefront of the community health worker. I don't want to use the word revolution, but we are leading the way on many ways. There are some other states doing some great things too, but we really are showing the value of community health workers, and these kind of investments through the state budget are critical. I would say for us federally, it's funny, Brittany, you said the people need to have their requests in by the 14th. I think that's also the same day where the federal government might shut down. So, might get lost in the news cycle. But we're very concerned about the Medicaid cuts in the reconciliation bill. They'll be devastating for everybody, but in an area like Southeast Ohio, we have maternal care deserts. There's a lack of providers already. If you now say, and we know in the governor's bill, there's automatic trigger language that would end the expansion. It will make the providers that exist down here that are working with our Medicaid population, I don't know how they would possibly survive. And so we will go from maternal care deserts. We will go from we have counties where you can't give birth. We have several of those where there's nowhere where you can give birth safely. We have counties with no OBGYNs accepting new patients. We have counties where the number of providers you can count, primary care providers you can count on one hand. And so if you take away the ability for them to continue serving that population, it will be devastating even for the population that you continue to cover, because it simply won't make any sense for those people to stay. And the other big challenge is, 50% of the births in Ohio are to Medicaid enrollees. And while those folks will continue to be covered, their families also need coverage too. And almost all of the people that we serve through and see through our hub, they are not in a position to afford any other kind of coverage. And the reality is, and I know there's a lot of talk about a work requirement for these folks, they are already working. But they do not are working in an opportunity that provides them with health insurance, and they simply won't be able to afford it. So we're going to see a coverage disaster in Southeast Ohio. People won't have health insurance, and they won't have it. And even if they did, they won't have anywhere to go to access those services. And there's no sort of incentive that you can put in place to change that other than continuing Medicaid coverage for these folks. And so that's really, really devastating. We're working a lot with a number of the plans to develop alternative methods of funding of the hub. Right now, we are very glad of the support of our Medicare partners, but to do this work is super challenging to fund the operations of community health workers, even though with the community health workers are the sort of the lowest rung of the nursing ladder and not necessarily the highest paid. It is still incredibly difficult to find the funding to build these networks. And one of the big challenges is because it's not sustainable ongoing funding, it's very difficult for community health workers to know, for instance, our goal is that we would see a mom through her pregnancy and through that first year postpartum. But if we don't know that the funding is going to be there all through that period of time, it's very hard for our community health workers to make a commitment to that mother to say, yes, I'm going to be here. Well, I'm going to be here as long as the funding continues. And so that undermines everything that we do. And so if we value a community health worker network, which is in these areas where we have these gaps, can really play a role, it's really critical that the funding that the governor has proposed is maintained. But then also I would love to see the state legislature and the federal Congress as well look at ways to expand access to this funding. And then I'll turn it over to Michelle.
Yeah. We are, I want to thank Groundwork Ohio and Advocates for Ohio's Future for always making it easy to stay up to date on what's going on. So yeah, at the state level, we are excited to see the governor's budget invest so much in childcare. So we're hoping that makes it through the process to continue supporting families up to 200% of the federal poverty line with costs of childcare. I mean, I'd love to see categorical eligibility to include childcare educators. The average child care educator wage in this area is about $14.50. So there's just no way, you know, to keep those folks in the workforce if they have to pay for childcare on top of that. And then at the federal level, just watching the Child Care Development Block Grant, that's what supports the Child Care Resource and Referral work that we do, and you know, ensures that this work is done consistently across the country. We want to make sure quality is always included, and that, you know, we're not taking away from keeping our kids safe with quality. So I'm just gonna leave that there for now. And let's see, we're always just trying to recruit and retain childcare educators in the space. So really want to see more investment, most importantly in the important and critical work that they do, so they can make a living wage and not be stressed out in the workspace that, you know, we rely on them to watch our children in. So that's just what we're advocating for always, and thank Groundwork and for the work they do. I know COAD will be at Advocacy Day next week. We have about 15 people going, and I know probably a lot of people on this call will be there as well. So we're looking forward to having those meetings and continuing just to advocate for children in this space. So
Thanks, Michelle. And I just can't underscore enough that the content that Paul and Michelle are sharing this morning is so ripe for delivering to our state legislators next week. So I hope everyone is taking notes. We'll send this out as a recording as well. We work probably more squarely in the child care and the maternal and infant health support space than some of the Medicaid piece. But I did want to just highlight, Paul mentioned that trigger language, that is poised, I think, to potentially jeopardize the Medicaid coverage of 770,000 Ohioans was the number that I've read most recently, which is a huge, even, you know, I think that's something that there needs to be a lot more education around in our legislature. And the trigger language essentially means that if the federal government invests even $1 below a certain threshold, that the funding, the state match is gone. So there's no ramp down, there's no deliberation period. It's just a very quick, this is gone. So for those group 8 folks. So want to just underscore how dangerous that is. Do folks have questions for Michelle or Paul about any of their programming? Thank you, Will. Completely agree. Or about how we can elevate the great work that they're doing and our advocacy work, or anything that you're seeing in your community that resonates with what's been shared from Southeast Ohio. And there are almost 80 of us on here. You can come off mute. It's just a meeting format. You don't have to be in the chat. Folks are just sitting with the somber realities. What's the awareness level for the community of these potential issues? Michelle or Paul, do either one of you want to speak maybe to community awareness around?
I mean, I in the broader in the community, I don't think a lot. I don't think it's broadly fully understood, and I think that's a huge problem because you know, we had a Medicaid cliff last year, and we'll potentially have another one this year. I don't think that people fully understand the implications of this. I do know that our agencies that we work with are very, very aware of this and are trying to communicate this. You know, I talked to one agency yesterday and they said we're much less worried about the work requirement issue because overwhelmingly the people that they work with already do work. And they're like, that's not that an issue, but they are very concerned. One of the things is Medicaid pays for most of, certainly in our area, the behavioral health services that we get. So we're going to have a significant number of people, in the aftermath of our opioid epidemic, many of whom who really need behavioral health support, who are all of a sudden going to have none of that support. And I don't know, I can't think of a good argument as to why we would want all of a sudden those people who are relying on that support to all of a sudden have no support and think that that's potentially a good idea, or worth saving any money for. The money that it will cost us, if saving money is the focus we want to think about, this is going to cost us a lot more money in the long run, and it is going to be devastating for families who don't have the resources to do this. And, the price of eggs is going to be small potatoes compared to the impact that this is going to have on people's lives. We are trying to make sure our community health workers understand the implications of this. But as I said, we have 28 community health workers, and we do know there's a Southeast Ohio coalition of community health workers, and I know they're talking about how best to make sure that people are aware and prepared for the potential impact of what could happen in the next few weeks and how quickly that would alter their lives. But I would just hope that I hope that it doesn't happen. We hear a lot from, federal legislators say, well, we're not cutting any services, and they're clearly leaving it up to the states to do, but they're refusing to recognize the reality of, Ohio has trigger language, and I think about a dozen other states have trigger language that will automatically do this. And I understand from the government's perspective, this is a huge amount of funding to make up within the state budget. But the impact of this going away is terrifying.
Thank you, Paul. And we do have a couple more questions coming through. We had talked about business engagement earlier, so some questions around whether they've been testifying, and I linked in the chat, they did testify earlier this week, more on the childcare as a workforce support side of things. Since we have another minute left, I think this one is a little bit more for you, Paul. I'll fold two together. One is, are there community health workers in other regions of the state like Cincinnati? Can you share a couple examples of options for services for folks who are utilizing the Pathways Hub for service connection
So
or service coordination?
Yeah, I said there are Pathways hubs all over the state right now, and in Cincinnati, HCAN operates the Cincinnati hub, and they've been up and running now for 7 or 8 years now. They're a very well established hub. There was a number of other entities, but there's also organizations, public health departments, hospitals, even some of the managed care organizations are deploying community health workers. There's a recognition that so much of healthcare happens out beyond the hospital walls or the doctor's office. Connection of services. So when you are enrolled with a community health worker at the hub, the first thing that's done is they do a sort of broad-based risk assessment of that individual through a sort of a conversational style that we teach, and we identify based on that conversation the risks to that individual's social determinants of their health, and from those risks we initiate pathways. And so there's 21 pathways, which range from everything from adult education to housing to medical coverage to social service referrals to transportation. And so what we identify are what those risks are, and then the community health workers use the resources available to them initially through the community action agency, but then beyond that as well, and they connect people to those services to eliminate those pathways, to eliminate those risks. And that's the idea. So, it could be, we're always looking as well to connect with entities and organizations around the region that provide other services that would be useful for CHWs to connect people with. And so if anyone knows of those, feel free to reach out to me. We'll always connect our community health workers with whatever services we can find.
Thank you. And I know we're hitting up on time. I really appreciate Michelle and Paul. You both are on the ground working with families and folks all the time. And we greatly value your partnership and advocacy and the work that you're doing in your region, and that you took some time this morning when things are so busy on all the fronts to share with our network. So we'll record this and send it out to everybody. And I'm happy to include the resources that you mentioned earlier in the call as well, Paul.
Yep.
Yeah, I
Thank-
emailed a few things to you.
Amazing. Thank you.
And I just want to say thanks to my staff because they are on the ground doing this.
Absolutely. COAD is incredible.
Yeah.
So
Yeah.
we appreciate you
Yeah,
all.
the community health workers do the hard job.
So thank you
thank-
for having us and thanks
Yes.
everyone for coming.
Yeah. Thanks,
Have
everyone.
a great morning. Safe travels, Paul.
Thank you.
Thank you. Bye.